Thank you, President. My question is for the Minister for Mental Health. Needle and syringe programs have a long history of helping reduce harm and save lives. They were first introduced in the 1980s in response to the HIV epidemic. Monash Health's needle and syringe program has been providing people who inject drugs with access to free and integrated support since 2005, I should say. This program helps reduce the risk to people who use substances of contracting bloodborne viruses and experiencing drug overdoses. It also reduces the social impact and the impact on the public environment by meeting people where they're at, embedding services in local communities experiencing harm. So my question is, will the Minister advise us on of the importance of this program and embedding services within affected communities?
Minister.
Thank you, President, and I thank Ms Payne for her question and her advocacy in relation to all of the work that needs to occur to reduce drug harm across the community, including in your region, Ms Payne, of South-East Metro. And you are correct, the Needle Exchange program is a very important public health initiative. It has been operating in Victoria since 1987, and it's one of the key public health measures we take to stop the spread of or minimise the spread of bloodborne viruses amongst people who take drugs or inject drugs in the wider community. In terms of the importance of these services, I can indicate that, of course, the NSP delivers across Victoria in a variety of different ways, including fixed site, mobile services. There's a disposal hotline for used syringes. There's the outreach and the foot patrol teams as well, and it's all about continuing to reduce harm. In relation to Monash specifically, as you've indicated, this program's been operating since 2005. Obviously, one of the key issues, apart from the harm minimisation and the public health response of a needle exchange program, is about education, is about also reducing stigma for those that use drugs, and so they can get that support in a stigma-free environment. And the government continues to be incredibly committed to these programs. We have a very strong record of investment when it comes to reducing drug harm. Since 2014, we've invested more than $3 billion to expand our drug treatment, supports and harm minimisation services, and of course, needle exchange programs are an incredibly important part of that approach. By way of example, the statewide action plan does provide an opportunity for a campaign in the CBD initially about reducing stigma and educating people in the CBD community about drug use and the impacts more broadly. And that, I think, is work that can be scaled up, if you like, and used in other communities, including other parts of the city where we know drug use is quite common.
Ms Payne, supplementary.
Thank you, President, and I thank the Minister for her response. By way of supplementary, members of the opposition continue to knowingly spread misinformation about these programs and drive stigma, claiming they facilitate drug addiction. So what steps is the Minister taking to address this kind of misinformation? Minister.
Thank you for that important supplementary question, and it is disappointing that people have a tendency to play politics with some of the most vulnerable cohorts in our community. And what I would say is that it's incumbent on everybody in this place to not be part of disseminating inaccurate information, particularly when the stakes are so high, particularly when we see alarming figures through the coroner's work in relation to drug overdose in the community. So it's incredibly important that accurate information is available to the community, including to, can I say, our diverse communities, and the need for continued effort when it comes to providing this sort of information in language to particular parts of our very diverse Victorian population.